Hello and welcome back to Talking Europe. They come under various names: Health Pass, Green Pass, Coronapass, and they're used by at least a dozen EU countries. They allow access to everyday activities such as dining, organised sports and public events, although the exact rules vary from one country to another. The pass requires proof of vaccination or proof of recovery from COVID or a negative test. Well, the measure has triggered a fierce debate about civil liberties and street protests. Italy is now making waves by making the Green Pass compulsory in the workplace from mid-October, a first for the EU. It's fitting, therefore, that we'll be talking to an Italian MEP, Nicola Procaccini, from the group of European Conservatives and Reformists, who joins us from Terracina near Rome. And we're also delighted to welcome Martin Hojsik, a Slovakian MEP from the Renew Europe group, who joins us from Bratislava. Unusually for an EU state, Slovakia began its inoculation drive with the Sputnik vaccine, so we'll be discussing that as well. But if I can start with you, Nicola Procaccini, thank you so much for joining us. This new requirement for the Green Pass in the workplace is actually the strictest measure of its kind in the European Union. Even France hasn't gone this far. What are your thoughts on that?
Hello, first of all, thank you for your invitation. And it's correct. Italy is the only country in the world where you need a certificate issued by national authorities as a mandatory condition to exercise a right that is recognized by our constitution, namely the right to work, the right to bring food to your family. And we think that this is insane. We started with the imposition of this instrument to get access to restaurants and some events, but we are finishing with a measure that is insane.
Do you think it's going to actually pass? I mean, it's supposed to come into effect from October the 15th, right? Is this actually going to happen, or will there be challenges?
I don't know. I think for now, from mid-October, we are with this measure, and we have to face this new reality. And for a lot of Italians, it's a dramatic situation.
I suppose you would say that the means don't justify the ends, because the statistics now show that as a result of this new measure, vaccination bookings have gone up quite significantly in Italy. People have booked more COVID vaccines because they know that from mid-October this will be required to go to work. So, like in France, this measure is actually boosting the vaccination program, isn't it?
Yes, we are aware that also in France the Green Pass is asked to get access to bars, cinemas, but in Italy it's different. And we have a lot of discrepancies that have emerged so far. Just to make a couple of examples, in Italy we have the Green Pass compulsory for long-distance trains and not for short and medium-distance trains that are the one full of workers. I think we have to listen. Let me be clear. We are in favor of vaccination. I'm vaccinated, but we have to explain to the people why is important the vaccination. But this is an unfair measure from Italian government, because the Italian government is not clear. Is not for compulsory vaccination, but it does hold to put the Italian people in a situation where vaccination is compulsory. I think this is incorrect, it's unfair.
Martin Hojsik, just for our viewers, set the scene. What is the situation in your country, in Slovakia, regarding COVID passes and also the relatively low vaccination rate, which, according to the European Centre for Disease Control, is around 50% as of September the 22nd. So it's actually one of the lowest rates in the EU. Is that a result of vaccine skepticism in general, or is it a result of Sputnik skepticism?
It is, well, first to explain the Sputnik situation. This has been something that our former prime minister has come up with in early spring and backfired. That's why he's former prime minister. And actually, there was a very, very little interest in getting vaccinated by Sputnik. I think it's below 10,000 people. Slovakia is vaccinating mainly with the approved vaccines of Pfizer, AstraZeneca, and Moderna, although even the AstraZeneca has gone down. But this conflict around importing an unapproved vaccine, unapproved by the European authorities, has helped to undermine the willingness to vaccinate. Parts of the government are undermining the vaccination efforts, and the opposition, including Social Democrats and the chair of the Social Democratic Party in Slovakia, who himself is probably proclaiming that he's not vaccinated and he doesn't want to get vaccinated, is undermining the effort. And let's remember, on the vaccination front, we are in the middle of the hybrid war with Russia, where Facebook is not doing not nearly enough, probably nothing for markets like Slovakia. You know, having a small bar, seek the proper information on COVID. If you look at the Slovak Facebook, it's full of misinformation, and the company is not doing enough in its duty of care to prevent spread of lies. Misinformation is too soft. Simply lies that are costing lives, because right now in Slovakia, the third wave is starting. The situation is getting worse by the day, and we are facing a situation where it could have been so much better if we would have a higher vaccination rate. And that's where really we need to do more.
On that last point, I mean, as Nicola Procaccini was saying, that forcing people is not the answer, that coercion is not the answer. Do you agree with that? Or should there be similar measures in Slovakia as we've had in Italy and France to make people's lives difficult if they're not vaccinated? Because there was a government attempt in Slovakia to offer some advantages to the vaccinated, which I think failed in the end. Is that the right way forward?
Well, it failed because a coalition partner was opposing it, which a coalition partner who themselves are kind of skeptical to vaccination, if I can name it this way. Now, I think what's the way forward is really to be more proactive in outreach to people. I think there could be way more done, but also there is a system in place, actually, that above certain threshold, the access to restaurants is either for the vaccinated, tested, or recovered, or the restaurants can choose, or places like movie theaters can choose to serve only the vaccinated. It's up to them. And the worse the situation is, the higher the restrictions are. So actually, it is already in place. And there are like places where if they decide to serve anyone, then the restrictions are the biggest. And for example, there is no seating and only takeaway service. So things are changing. And I believe, for example, that there are certain professions where the vaccination should be mandatory. Just like when you're a truck driver, there is a mandatory that you have a driving license, and no one is questioning that. So I believe that, for example, in the healthcare service, this is something which should be obviously mandatory.
Yeah, I mean, it's a bit different for truck drivers because, it's not the same as having access to a restaurant or a cafe or everyday life. But Nicola Procaccini, what do you think?
No, sorry, I'm talking not about access. I'm talking about the conditions that you need to fulfill to get a certain job.
Right, yes. Okay.
You have an access. That's a very different thing. If you have a job as a truck driver, you need to have a driving license.
Okay, Nicola Procaccini, on that point, do you want to respond?
No, yes, it's completely different. The license you need it to drive a car. The green pass, the Italian, that is completely different from the EU certificate COVID pass. It's in Italy, if you want to leave, you must have this pass. Instead, you can't leave. You are rejected from the society.
Yeah. What's your alternative then? I mean, we've seen in France, for example, efforts to try to reach out to people. That didn't really make a big difference. What made the difference was the health pass in terms of making people book vaccinations. What is the other? What do you propose instead?
We think that you have to explain why it's so important, the vaccination for the people. You have to convince the ones who fear the reactions, but you have to arrive to the people. You have not to exclude the people from their life, from their work, from their family. It's really not correct.
But if they can't be convinced and the result is infections go up again and there's more lockdowns, that's also not a good situation, is it?
Yes, but why don't you make mandatory by law the vaccination? I think it's more fair that this measure, if the Italian government and all the other governments want to make advance the vaccination, they can do it by law. But this is another thing.
Okay. Well, we could go on for much longer. Now, I'm sorry we don't have more time to thrash this out, but that is now the end of Talking Europe, and I'd like to thank my two guests, Martin Hojsik, a Slovakian MEP from the Renew Europe group, and Nicola Procaccini from the group of European Conservatives and Reformists. That's all for this edition. Thank you so much for watching.